This is simplified hormone tissue delivery model. So the hormone comes into the cell, okay? There's the hormone. If it's in the extracellular space, because they're fat soluble, the extracellular space is more lipophilic than the hydrophilic bloodstream. So if I am fat soluble and the bloodstream is water soluble, the serum is water soluble, where would the fat soluble hormone be most attracted to? The extracellular space, because that's more lipophilic. Just like oil and water don't mix. So the oil is going to separate out, the fat soluble is going to separate out. So if it is in that extracellular tissue, where is it not? It's not in the bloodstream if it's in the extracellular tissue. But it is still available to go across the cell. That extracellular space is pretty vast. And so a lot of hormone can get stored in that extracellular space and in the fat tissue. Okay? So, here is the concept I want you to understand. If I rub testosterone or estrogen or progesterone on my skin, it's only going to stay in the bloodstream, and Dr. Zava can give you the exact milliseconds or seconds that it stays in the bloodstream or whatever. He can do all that. But anyway, it doesn't stay there long. It's going to want to go to a place where it's comfortable in the extracellular space of the fat tissue. Okay? So if I rub it on my skin and I look at it for it in the bloodstream, I'm not going to see an elevation in the bloodstream because it doesn't want to stay there. Okay? So what I do is, if I'm just hell-bent on looking at it in the bloodstream and I want to get that level up to where he was when he was 25, what do I have to do? Well, here's what you have to do. You have to put enough hormone in that extracellular space and in all the other fat-soluble tissue to the point where it crowds out the hormone and pushes it back into the bloodstream. Okay? If you mix oil and water and you concentrate it enough and put enough pressure on it, you will begin to get micelles of oil back into the hydrophilic water. So the only way you're going to get that testosterone level back to where that person was at 25 is you've got to saturate the tissue, and then it will start going back into a uncomfortable space, which is in the blood. Pharmacist, can you tell by the dosage that the doctor writes how they're monitoring the hormone? If they monitor them by blood, they're going to order smaller doses or bigger doses? Bigger doses. If they're monitoring it through saliva or urine or whatever, they're going to order smaller doses. It's just a fact. Because the only way you can get that blood level up is you've got to first saturate all the other tissue. I can't tell you how many patients come in and say, my doctor says I'm not absorbing the hormone. I had one lady, I promise you, I can show you her levels. She came in because her husband was afraid of her because he thought that she was going to hurt him. And the doctor kept telling her that she wasn't absorbing testosterone. And one other thing happened is that she noticed that she went from soprano in the church choir to alto, and she was just about to get moved to the baritone section. And they kept telling her that she wasn't absorbing testosterone. And we looked for it in a place where the action is, and we saw that her testosterone level was about 7,000. And it took literally 3 years to get her testosterone level down. And I can show you, and if I do my hormone lecture, I can show you each 6 months I was bringing her in, and we finally got it back down to a normal level. And thank God hadn't been on the nightly news, murdering her husband. But anyway, all right. Now, I was going to give you this overview. How can you find out where the action is? Here's how the saliva gland works. The saliva gland, what it does is, and again, I'm just going to give you the little synopsis. If you want to know how it really works, ask Dr. Mead or Dr. Zava. They do this stuff every day and been doing it for a long time. But fat-soluble hormone that goes in the cell, because remember, as long as it's in the extracellular space, it's available, but it's not really doing anything. Okay, so that's not a good measure either. You want to know what got into the cell. The funny thing about the saliva gland, the acinar cells, those yellow things up there, the acinar cells of the saliva gland, they are in equilibrium. Fat-soluble hormone in that cell is in equilibrium with the saliva. So you can get a little biopsy of how much hormone is in a tissue by looking at the saliva. So you say is, but I'm not worried about how much is in the saliva. I want to know how much is in the uterus and how much is in the brain. But the way this works is, and he can tell you all the studies, I'm just going to, believe me, I've listened to a lot of lectures on this. What happens is, if you know the normal range in the saliva, and if that is in the normal range, then you can be pretty assured that the range is normal in the other tissue. Yes, the uterus is going to concentrate estrogen and progesterone more than other tissues, but it's going to give you an idea that if the saliva is way out of bounds, then probably the uterus is way out of bounds. If the saliva is way under or over, you can extrapolate that out into other tissues. So it's almost like taking a tissue biopsy where you don't have to do anything invasive, okay? So this is telling, because where did I tell you the action takes place? In the cell. So you want to know how much is available to the DNA, and those acinar cells of the saliva gland give you that opportunity. Now, you can say what you want. We can talk about urine. I'm not going to get into big discussions, but I'm going to tell you my career changed when I understood this. It changed my whole career. When I started doing this, I stopped asking people how old they were. I asked them, but it wasn't that important. What was important is, what was the action of the hormones? Because I understood this, I didn't put every man I saw on testosterone. I put very few men on testosterone. And tomorrow I'll talk about how stress affects hormones. And most of the time, if you relieve the stress, ovaries and testicles will work again. So I had very few men on testosterone, so I'm not worried about what the FDA says about testosterone. Because I made a commitment, I was going to practice hormone replacement by the book. Okay? So this is an article on saliva testing. I think I have it where it's supposed to pop up, but where? Summary. Although saliva has not yet become a mainstream sample source for hormone analysis, it has been proven to be reliable and in some cases even superior to other body fluids. And this is from the Journal of Steroid Chemistry. I thought I had a pop-up. It may just not gone in. But that's an article from like 2008,